Subha, just like you were mentioning, there's that high level vision of where we should be headed that doesn't get bogged down in the day to day, because there is a crisis every day in every hospital in our country.
Absolutely.
It's every day.
We are going to sit down for Sharp Conversations. I'm Janae Sharp, the founder of the Sharp Index, and we want to talk about the state of, healthcare and mental health. And I'm really looking forward to this, to talk to Kelly Conklin, and Subha is my co-host, and we're going to be talking about all things staffing, coordination. Basically, I wanted to talk to Kelly to hear more about how your work has been impacted by staffing crises. There are over 1,000 nurses right now that are on strike. And it's been something we hear a lot about and people ask about solutions. So if you could introduce yourself, that'd be awesome.
Yeah. Janae, Subha, thanks for having me today. Kelly Conklin, I'm the Chief Clinical Officer at Perfect Serve. Kind of background-wise, have been a nurse for a number of years, did kind of ED trauma and lots of leadership roles before making a transition over to doing consulting around improving healthcare and outcomes. Likely when value-based purchasing started and the focus was on how do we connect those dollars to better patient outcomes and rewards. It was a pretty exciting time. Did high reliability for a while, and then just decided one day to transition over to the tech side of things, which has been an interesting opportunity as well.
Yeah, it's really different.
And hi, everybody. I'm Subha, Airan-Javia. I am a hospitalist and an informatician in Philadelphia at Penn Medicine. And I'm also founder and CEO of Caroline. And similarly, very passionate, Kelly, about improving quality, and making it easy to do the right thing for patients. I think we often in healthcare, my experience at least has been that I only see organizations make changes in a reactive way instead of in a prospective way. And I do feel like that's different with value-based care initiatives. And it's one of the things I love is, we need to make sure that we're preventing these things from happening in the first place. So it's interesting to hear you say that really was the start of a lot of these changes for you.
Yeah, I loved it.
Actually, I met Perfect Serve because I knew the people at Lightning Bolt who did like scheduling rules for safe scheduling. And, residents have scheduling caps, but most systems don't actually use those systems. They don't actually track resident hours. So one of the things the nonprofit and my vision personally is that technology shouldn't be something people complain about. It shouldn't be something that's that's a burden. It should be something that helps healthcare. And that's kind of what I like about Perfect Serve. And I liked too what you said about how there's a transition. You're like, it's different, tech versus the clinical care. And that's why I thought it'd be interesting to sit down with both of you to talk both about bridging that gap and this bigger vision of technology as an asset. Like, at what point will we know technology is actually adding value? And I don't know if you've done that in your work. Like, have technology resources or analysis, has that been part of the conversation with building a value-based care?
I think when we talk about technology in healthcare, it has to be something that I don't have to go seek. Like, I'm busy taking care of patients, whether I'm a physician, a nurse practitioner, a nurse at the bedside, I'm taking care of patients. And that's what I want to come to work to do every day. I don't want to say, I wonder if that came back. Let me go and see. No, it needs to be something that's pushed to the right people at the right time. So their time is spent taking care of the patient, not going to look for information to make that job easier or better. I think you have to include the teams that are going to use the technology. So many times a technology is purchased by a system based on price or based on,
based on based on who
Business
even knows
needs.
what.
I mean, Kelly,
Exactly.
I have literally been talking to some organizations lately who are investigating new EHRs. They don't have a single physician or nurse on the team. They only have the business people defining requirements about reporting and all of these other things. I was like, I don't understand. Who do you think is going to be putting the information in here? Like, oh, well, the physicians we'll just have them, use it. They haven't even looked at it.
I think one of the scenarios that has been so exciting over the past year actually is working with a large multi-state health system and implementing what we call care mobility. So it's a way to take and push messages through the EMR or through a mobile device that they're carrying in their pockets. And the nurses came to the implementation team while they were rounding with the CNIO and said, "This is fantastic. We love it. And you know why? Because you included us in how to design it. And then you brought us to the table after it was implemented and you let us make the tweaks to make it even better." So hearing that from a nursing team, first time in 5 years probably that I've heard that.
Oh, wow.
It's all about the governance and the leadership and the buy-in.
Especially these days when people are so unhappy with many different things about their jobs in medicine. I think that a lot of administrators undervalue the impact that technology plays in how a clinician, a nurse, anyone feels and how likely they are to get frustrated and walk out. Obviously, technology isn't everything, but it's a huge factor on both sides, right? Like little things can provide so much relief to at least just kind of bring you down under that threshold of, I can't take this anymore. And I think that, I'm curious if you found the same thing, but my impression has always been that decision makers in organizations, in healthcare organizations, don't realize how impactful technology can be on helping their workforce's well-being.
Yeah, I like to think positively and think that when these decisions are made in a vacuum, that they're made with good intention, that they're making decisions and not involving people because they think it's another person pulled away from the bedside. Or we can make the decision faster and quicker and more efficiently if we don't involve people, which in reality is probably true. So I like to think of that positive piece. But at the end of the day, it's generally not the direction that we should definitely be. We should. When
I hear that too, I think about the reports about physicians who don't believe their leadership is going to go in the right direction. And with a nonprofit, one of the things we realized is that prescriptive programs for well-being don't seem to work. But the power of choice is something that will impact clinicians and will impact patients and everyone positively. So often people come to us and say, well, which program is best? And I say, well, whichever one your people picked is the best one. Because it doesn't matter if it is yoga. If they picked it, it's going to have a better outcome. If it is something else, there are so many opportunities to improve that you could really pick. But that power people have when they were involved in the decision and when you give the power back to clinicians, that is the difference between leadership that people have trust in and people want to work for, and leadership that they're going to end up losing more people, which is, as we know, is like a huge financial strain on the system now. So I wanted to say something about that. Like we know people are losing faith, and that's kind of sad, but it's also, I think, eye-opening for a lot of people.
It's an opportunity to help people feel heard, right? Like a lot of people feel ignored. And when you take their feedback and implement it and say, hey, we're listening to you, and you've told us you need this, we'll make it happen. It goes a long way with people who already feel like they're being trampled on.
Right. Subha, you're a hospitalist, so you remember it was probably 5-6 years ago, and I don't know if it came from IHI or not, but it was a patient mantra that said nothing about me without me. And it's kind of the same mentality that you have to apply.
Yeah.
Don't be bringing things to the table if you don't get my input and my feedback on it.
I mean, I'm sure, Kelly, you can provide some. I'll give one, which is, in what other industry is your main workforce, and I'm talking about all frontline healthcare workers, but your main workforce who's supposed to like provide your service and then, you know, document your service so that you can then generate business off of that service, constantly saying, this isn't working, the system isn't working, it's killing me, I like, you know, this is broken. And you're just like, oh, I'm sorry, suck it up. I paid $1 billion for this system, so you're just going to have to use it.
And that plays out over and over and over again. And then it's like we've invested time to implement the technology. Now it's so cumbersome to unravel all of that work that we're stuck with it. We're just stuck with it. Or the amazing thing is, I've seen systems go and spend additional dollars and resources bringing in a second technology that does the same thing as what the complaints are being about, because they're trying to. I mean, it's just mind-boggling at times.
I think a big lacking there is someone who says, this is our overall strategy of how everything fits together. There are people who should be doing that, I think, but oftentimes their jobs just get burdened or their plates get full with implement this, implement that, and it has to be by this time. Instead of saying, wait, what is the strategy and the experience we're providing to our workforce? And how do all of these different things fit into that? And that's how you end up with all of these piecemeal things. And on the flip side, it's no, you have to use just this one system, even though it's not working for you. So it really has to be a balance. You can't say use 100 different things that don't work together. You can't say use one thing that doesn't work well. I think every industry needs a tech stack. Medicine is no exception. Clinicians are no exception. That we need a suite of tools to do what we need, but they have to work well together.
I also want to say, so in the nonprofit world, like since we just started our own, there are a few things they tell you to do. And one of them is that you have to stay focused on this long-term mission, and that funding becomes an issue. There is a different mind space that's happening if you're doing long-term planning versus crisis planning. And that is something every time I meet with other nonprofit founders and other founders in general, like the ability to have that long-term vision when selecting technology and when making a plan versus this short-term crisis mode. Have you seen strategies, and I'd love to hear them, like personally, like anything, have you seen strategies that work, that help people who want to do that?
I think the most successful organizations are those that do just that. They keep their head up out of, and Subha, just like you were mentioning, there's that high level vision of where we should be headed that doesn't get bogged down in the day to day, because there is a crisis every day in every hospital in our country.
Absolutely.
It's every day. And you can get kind of stuck in a quagmire of like, you know, just reacting. The churn of it. Yeah. So and that has to happen. Somebody has to do that. But the higher level vision and strategy needs to be there. The other thing I hear most frequently is we've got so many vendors that we work. We'd like to have a vendor that does more across the continuum of what we need. More, like in my case, it's communication. Like, do you do more pieces of the communication than others do? Because we'd like to have that one partner and not have to worry about the integration fees and moving information and duplicative efforts. So those are the kind of things that I hear about from a communication perspective.
Yeah.
We should talk more later, Kelly, because I think there's also so many different aspects of communication and collaboration, right? Communication is one way to work together. And there's pieces that I think are missing in the typical technology stack for an organization.